Folks, for decades, we've built a healthcare system that is extraordinarily advanced in treating disease, but remarkably underdeveloped at creating health. We wait for people to become obese, diabetic, hypertensive, depressed, have all kinds of inflammatory diseases and chronic diseases, and then we intervene. And while we have, no doubt, over the last few decades, increased the lifespan, we have actually also decreased the health span. And for those of you who have elderly parents, you know exactly what I mean. The science verifies this, that at the end of life, the last few years, we're seeing an increased number of years where people, yes, living longer, but not living healthier. And so that's why this topic that we're going to talk about today is so exciting. Health longevity. This is about not just treating disease, but getting ahead of it and actually really fundamentally redesigning health so that we live longer and healthier. Today, I'm joined by Dr. Tzipi Strauss, who is one of the leaders internationally in this field. Tzipi is a physician. She is a neonatologist and a pediatrician. She is a professor of medicine. She is a researcher and scientist and a leading voice in this field of longevity medicine. She is the founder and director of the Sheba Longevity Institute or Center. For those of you not familiar with the Sheba Medical Center, it is one of the top medical centers in the world. In fact, I was just looking at Newsweek. Sheba Medical Center is rated number seven in the world. And so one of the top leading academic medical centers and a public health institution. Dr. Strauss is a pioneer in this longevity medicine approach. We're going to hear a lot about that. I can go on and on about her. As I mentioned, she is a full professor at the Tel Aviv University. She received her degree from the Technion Rappaport Faculty of Medicine. She went to Harvard and got a master's there, which is where we met a number of years ago. What I think is also exciting, again, there's a lot of people in this field. Tzipi is a scientist, a researcher, a technology guru, a physician based in medicine for decades and decades. And she is one of the leaders in the Longevity Institute. And this is the reason I'm talking to her today. One of the things we may not get to as well is, and this is super exciting, is she's going to be an instructor, a teacher, a lecturer at Harvard University, and probably one of the first courses of its type, a course on the science of longevity medicine. And she is actually going to be teaching how that is applied to the actual practice of medicine. That course is not available yet for those of you who are interested, but it will be available soon. Tzipi, I could go on and on about you. I apologize, but so excited to have you here today. You're coming to us from Israel.
Indeed, yes, I am. I'm very exciting to be in the podcast and, of course, chatting with you about this exciting subject. And yes, let's start.
Let's do it. So Tzipi, I have so many questions, but let's start with, I've started to hear about longevity over the last year or two. Before that, you heard about precision medicine. I've actually spoken to experts, physician researchers like yourself about lifestyle medicine. How do you place longevity medicine in sort of the schema of regular medicine, lifestyle medicine, precision medicine? Where does it fit in, and how does it differ from traditional medicine? Like, I go see a primary care doctor and I get my preventive treatment. How is what you're doing and what longevity in general, the field of longevity, how does that differ from what we're doing today?
First of all, it's not different, but it's kind of like a step forward. And I will say like this, you and me, we are both physician, and I'm like the traditional medicine is a reactive medicine, which means we have a disease, we treat. There is a tumor, we take it out. This is most of the medicine that we know. Then we have the preventive, which is this is a step forward, meaning you come to your doctor, he check your hemoglobin A1C level, and if it's 5.6, it's fine. You are not diabetics. Okay, go home. And you are relieved and you continue on with your life. You come to do some stress tests. They say, oh, your EKG, everything is fine. A check, you are relaxed. I will come back next year for another checkup. This is preventive medicine. And when we talk about longevity, it's a step forward. Meaning, when you come to a longevity clinic, or for example, for our clinic, so we are doing the assessment. I want you not only to say, okay, this is checked, it's okay, there is a range. I don't want you to know when there is a range between 100 to 500. So if you have 101, it's green, fine, go home. No, I want you in 300, for example. Just an example. Because I want to optimize, first of all, your results. So there is good, there is excellent. We want, first of all, excellent. So, but this is one part. This is when we are talking about performance. So longevity is a little bit broader than that. I think when we look at longevity, and the reason that in the last few years it got on very hype, because we combine technology in it, we combine monitoring, wearables, and AI. And the fact that we can have a lot of data on people and try to understand cause and effect and trajectories together with performance and physical performance and a lot of data on a lot of people, with this, I can say, okay, you are here, but compared to all the population at your age, you are not, you are like on the 20th percentiles or your 40th percentiles, but I want you on your 80 percentiles because we all decline. So I want you to start decline from the top of the mountain and not from the middle of the mountain.
What is the array of these tests? What are you looking at? And again, to me, it's sort of like you're literally now opening up the mechanics of health, as opposed to, you know, kind of the little bit further downstream. So I'm just kind of interested, what do you test for?
So the idea, and especially I think in longevity, and people feel that they have a lot of tests. Like people come in for our center, they come for 5-6 hours. But it goes like this. They don't feel it takes 5 hours. Everybody likes to test themselves. And it's a good experience. But we are checking, first of all, a lot of things in different systems. So we are looking on the brain and the heart and your sleep and your mental status. So all of this affect your health. And at the end, we try to create kind of algorithm like today we have in cardiovascular, that you have your score of what is your cardiovascular rate, which every physician is using. So in longevity, we're trying to find out what kind of risk assessment, but you try to combine a lot of data. And this, as I said, we can do it through AI because we have the technology nowadays more and more to get all this data. So we can develop this dashboard that gives you scores in different systems, and then it's easy for a person. Wow, my score in my stamina, my muscle and bone and fat is 70. I have to put effort in my muscle because it's not enough. And then the sleep got a low score because I have obstructive sleep apnea and I need a CPAP. And by the way, everything affects, one system affects the other, because if you don't sleep well, you get irritated, your cognition might be interfered. So we try to look at the big picture of a person, and I think this is one thing of longevity, that it looks on the person as a whole.
Do you said that you discovered 4 things that correlate, and you mentioned, and I wrote this down. You mentioned cardiovascular health, body composition, balance, sleep, and being female. Can you say what those factors correlate to? Yeah.
So we were curious what correlates with young biological age. So we looked at all the cohort and we wanted to see who are the ones who are younger biologically. So first of all, women. Women are younger biologically. Like if you take male at 60 and woman that 60, the male usually are 2-3 years older. If you check a woman, she is or the same or younger in 1 or 2 years. So just being a woman, and I always laugh because, I'm a neonatologist, and it's not only, it's like it's from the beginning. For example, and it is known, if twins are born and it's a boy and a girl, we know that if 25 weeks, 1 kilo, boy and a girl, the girl has more survival rate and neurodevelopmental outcome is better. So just being a female, when you are born even, compared to a male when he's born, if they are twins, she has better outcome.
Interesting.
So it starts even in utero, which...
And better outcomes, you say, as you get older. Women just age slower biologically.
Yes. So this is number
Interesting.
one. Yeah,
Okay.
this is number two is what we said, low visceral fat. We know that visceral fat has, it correlates visceral fat with cardiovascular, with metabolic syndrome. Women gain it with the decrease in estrogen. So that was having a low visceral fat correlates with low biological age. Second one was a good cardiovascular health meant it was more good aerobic exercise. So if you have high VO2 or you are in a good wait for the beginning. So cardiovascular meant that you need to be in a good physical shape. That was number two. Number three was balance. Balance is extremely important, which was kind of surprising. We didn't even think about it, and it came out in a very strong correlation. Which when you think about it, it's reasonable, because when you have low muscle mass and you are frail, you have what we call frailty or sarcopenia, which your muscle mass is decreased, you kind of lose your balance. So it might make reason. And sleep. The provision of sleep is extremely important. Like sleep is one of the hallmark that we said for longevity is the provision of sleep goes together with metabolic syndrome, with obesity, and we really focus on sleep, which is something that also now in longevity.
Right. And this is, again, I think the fact that you're able to collect all this data, put it through the artificial intelligence algorithm, and let the correlations, the mathematics actually work itself through that to show, because you're right. I mean, cardiovascular, I mean, if I'd asked a regular physician, they probably, like if you asked me about what correlates, I would have said something like LDL cholesterol, high blood pressure, things like that. You've really used the mathematics and the metabolics to find these four things. And you're right. I would not have guessed sleep or balance. They would not have come up for me in that. The body composition is interesting because of the visceral fat. I haven't done a lot of looking into this, but my understanding about visceral fat is it's a different type of fat cell than peripheral fat, in that it is much more inflammatory. And so that's, and I think we're just beginning to understand chronic disease is actually, even cardiovascular disease is actually an inflammatory disease largely. And that's been emerging over the last couple of decades. Let's jump to, so you do all this testing. You have this amazing science and technology that really correlates all this. You're able to tell me, how this all fits together, what my biologic age is. Treatment, interventions, which you mentioned, you touched upon. When I talk to colleagues and friends who now go to longevity doctors out in the community, again, they're out there quite a bit. It's become, I think, it's going from hype to a buzzword very, very quickly. And everyone now is a longevity doc, right? Everyone's into that. But what I hear is, okay, you get a few, get some blood tests, much more than you would get otherwise. But then I hear a lot about, GLP-1s, these peptides. All I hear about is peptides, peptides, peptides. I'm getting peptides. I'm taking peptides by mouth. I'm getting injected with peptides. So two questions there. One is, what are your interventions? Number one. And number two, what do you think about this whole sort of emergence of, I mean, again, Tzipi, I don't know about you, but we call them here tech bros, so the people, who are technology entrepreneurs, and they're all on peptides. I mean, it's the latest fad, in Silicon Valley. It's the latest fad on the East Coast in Manhattan. I hear people, these young people in their 30s and 40s and 50s and 60s, they're all taking peptides, injecting themselves everywhere. For my part, I'm just a little, having been in medicine for 4 decades, I let things simmer for 4 or 5 years and see what happens before I start treating, because I'm just not clear the science is there. But again, you're the expert here. You're a world expert in this. What do you think? What do you treat, and what do you think about what's going on out there with peptides?
I will start with the reason that we insisted to do longevity in academic hospital. I could open a longevity center, a private one. I will get a lot of money from it and be very rich and maybe happy. I don't know, but it was actually not my goal. As a physician, and then I'm a physician in all my cells, the idea to do it in a public hospital is because longevity became such a buzz that every person is considering himself a longevity without even having an MD degree sometimes, is the reason why we wanted to do it in academic hospital. So the treatment that we are given and the intervention are only evidence-based. And people ask me about the center, and I said, listen, there are all kinds of different treatments. And I'm sorry, but peptides has no evidence, okay? And there are case reports that they will actually cause people to go into the ICU. Different things, different peptides, you don't have no regulation, all kinds of injection in I don't know who, what, and where. And didn't even prove to do something. I mean, what is peptide? I mean, insulin is a peptide, so every diabetic is injecting peptide. Yes, he needs insulin, okay? But,
Right.
so, there was a time everybody injected growth hormone. I don't know if you remember that.
I remember.
Growth hormone. At the end, they found that it increased tumor. Okay, just saying. Careful of what you're injecting to yourself. It's not like it cannot harm. It's like all the additives. I always say, most of the people that comes here, and we have all kinds of these longevity freaks that inject or do and come with this bunch of supplements. And most of the thing, what I do is do like this. All this, out. Out. First of all, there was a study in JAMA that showed the publication not long time ago that showed that people that take supplements actually die earlier than the one who didn't.
So just to pause there, I'm going to look up that study, but it's so funny because I really started to get into this again. There have been waves, like most people get into this, and I went out and I listened to people, experts, and blah blah blah. I had a whole cabinet full and fridge full of, literally one whole floor of my fridge was full of supplements. I did it for 2 months or 3 months. And then I started to read a bit more. And then I started to pull the supplements away until finally that shelf is empty. And now I have a fridge again. I can put food in it, healthy food. So I put vegetables and fruits. But to your point, it's.
Yes, so it's and the main problem is, by the way, that there is no regulation on supplements, and actually there was a study from Singapore that they did, NMN, NAD, everybody's taking NAD, and they really checked 20 different supplements, and they checked what it says it is in. There was no correlation. It was between 0 to 1,000, and on the package it was written 200. There is no regulation on that. So take a supplement, you have no idea what it is covered with, what is the additive there. I have people here with toxicity of B6.
Mm,
Now, B6, thiamine, is usually they put it with magnesium in compounds, all kind of things. And B6 can be toxic, neurotoxic, actually. I
mhm,
have a patient with 1,000, and it's very difficult to get it out of the system. So it's not supplement that, if it will not help it, it cannot harm. It can harm.
mhm,
Can harm. People don't know it. Take Q10. People, it will give you strength and help your heart. That's true if you take statin, but it is contraindicated, for example, if you are taking aspirin.
mm,
People don't know that. So there
right.
are also contraindication, or to take
Mm,
omega-3 if you are taking aspirin or anticoagulant is
mm,
contraindicated. I mean,
mhm,
I have children that came to the ER with
mhm,
bleeding because
mm,
the mom thought that omega-3 is extremely good for ADHD, and it
right,
got tons of omega-3. No, it can harm.
right.
So we have to be careful of what we are entering our body, and what
Mhm.
is also, I don't know what is the interaction between different, like 100 pills that somebody is taking, and what are
You know,
the
so
compounds of that.
So, Tzipi, I think you're making some really, really important points. Number one, what I hear from you, just to summarize, is there isn't evidence for a lot of these really scientific evidence, strong evidence for the benefit of these supplements, including peptides at this point. Which, by the way, I have to tell you and share with the audience. When I listen to Dr. Eric Topol, who's one of the greatest researchers, scientists of our era, talk, he says exactly what you say about peptides, and he's had lectures on it, and he's like, there's just no evidence that this works. And so, number one. Number two, we don't even know if what's in there is actually in there because it's not regulated. Number three, it isn't that it's like, okay, I don't mind spending hundreds or thousands of dollars. What's the harm? There is a harm because these actually do interact with other things. And so, overall, so what I'm hearing is let's put the peptides and the supplements aside. So if that's not the mainstay of your treatment, what you are recommending when you assess a person and you look at whether it's sleep or musculoskeletal, or what are the domains of assessment, and then what kind of treatments are you actually giving at the Sheba Health Longevity Center?
So first of all, it is, let's say 70%, of course, it's kind of a lifestyle. Okay. I
Mhm.
always say to people who come to longevity, and you need to address the expectation. Also from the longevity field, people say I will live forever. The longevity so far and until now, what it will help is to help the gap between lifespan and health span. So we can try to live better, more years, and it
Mhm.
will increase our lifespan. Maybe in 5 years, maybe
Mhm.
the average in Israel it's 85, it will be 90.
Wow.
Okay,
Right.
yeah, we are better than the states.
Yeah. States by
We are number
significantly
4 in the
better.
world.
What's
Although
that?
we are number 4 in the world of life expectancy, 4 or
I didn't
5.
know that. I didn't know
Yeah,
that.
Israel is it's in the top.
So,
Uh,
folks, for just for reference sake, the United States is 40th in the world in terms of longevity, and actually 80th in the world when it comes to health longevity. And we are getting worse. Just a little bit of tidbit. Yeah.
so the main focus today, if you ask me, in the lifestyle is to improve the health span,
Mhm.
our life that we are living in a good quality life, which is very important. I mean, we don't want to deteriorate and live our last decade in a wheelchair, not remembering our spouse. Okay,
Mhm.
this is what we all are afraid of, and we want to prevent. And this we can actually do with the intervention that I will go in a minute.
Mhm.
I want to emphasize that the big shift will not come from lifestyle intervention. It will come, in my opinion, from the combination with pharma, with
Interesting.
yes, with it will come with a combination of, and I do say that the GLP-1, the peptides, all these are very, very promising
Mhm.
But now, if you are a mouse or a lizard or C. elegans, okay, it will help you then, because these are the studies, and so many
Right,
studies are very helpful to the C. elegans and in the lab, but
right.
then it nothing in our we are not C. elegans, okay? We are not animals. So even some peptides that are working amazingly in the lab in vitro still are not proven to be in vivo. That's what I'm saying. There are no evidence. There is evidence, but what happened is that there is a study. Wow, amazing! Life expectancy by double. The
Hmm.
mouse become the gray hair becomes black, beautiful, and then people say, "Oh, what did they give? Quercetin? Yes, let's take quercetin. Let's take mTOR inhibitor. Let's
Hmm.
take GLP-1." Um, well, GLP-1 has studies on humans, but
Right,
all
right,
the other supplements,
right,
but the fact that they're working, but the media makes it kind of like, wow, it helps, and then people are, oh, okay, let's buy it. Still no evidence that it works.
right,
Would be.
right.
So this I want to emphasize. This is one thing. So the intervention still, and the expectation is we want to live better on our last decades. Okay, we
Hmm.
want. I call it. I want to die healthy.
What I'm seeing is exactly what you say. Contrast that to what I see more commonly, which is people end up with dementia, which is growing, is becoming more epidemic, and live their last few years with cognitive decline, which is just horrible for them and horrible for their families. They have strokes and heart attacks, other inflammatory problems, rheumatologic problems. And you're literally living your last 5, 10, years. And again, this is what the evidence is showing us in a state that's really debilitated, extremely costly, and, horrible for the individual, but also really it's not good for the family too. They suffer along with the individual. I think that's the part that we don't realize. It's just, on a very personal level, and I see this with our family and with my friends, it takes a lot of energy and time. It's sort of I don't want to use the word depressing, but it really adds a whole other stress. I mean, we call this the sandwich generation, but I don't think we've actually appreciated how much strain it puts on. And quite honestly, I think most of it is on women and mothers who are already taking care of their families. Now they have to take care of the elderly parents, whether it's theirs or their spouses. And so I think what you're talking about is really, really important on so many levels, not just personally and family, but also on a public health and population health level in terms of the amount of strain it puts on society. And the last thing I'll say about this is particularly important in more developed nations where we see now a growing imbalance. So there are less and less young people for older people. So now there's actually one working American, three working Americans for every one elderly. A few years ago, it was 7 to 1. So you could actually distribute that challenge, that burden, that issue. Now it's less and less people taking care of older people in our society. It's really, as and as you talked about, we're getting older. The society's getting older. The demographic is older, and so this has implications that go beyond even the individual and their family.
Absolutely, it's not only emotional burden, but it's also financial burden, economic burden, which one of the things that we want to have it as public, as longevity for all, as I call it, is also from the financial perspective. Because the amount of money that we spend on the last decade is times 7 that we spent from the decades before. And so it's also
Wow.
not only from individual perspective, but it's a nation perspective. So the longevity is not only for an individual, but for a nation, for demographic. 25% of the population will be above 65 when we look at the forecast in 2040. And when you
Wow.
mentioned 3 to 1, working to the ratio. In 2040, the ratio in the world population is going to cross, meaning we have more elderly people. It's going
Wow.
to be more elderly people than people below 25.
So
So
that's great. I didn't know by 2040 that ratio is going to be
40,
literally
yes, if you
1 to 1.
graph, it's going to be like this. And then the 25 goes down, the 65 goes up. This is
So
the
the implication here, so Tzipi, the implication is really, I had not realized this before. The implication isn't just, oh, this is great for me as an individual. It's great for my family. To your point, and again, I didn't realize that in the last decade of life, what you're saying is we spend 7 times more in the last 10 years of life than we on healthcare costs than we did, which is financially devastating. I mean, I know we spend a lot before that last decade of like 7 times the amount. The idea that we're going to cross or we're going to have as many elderly as we have non-elderly, to me, that is a international financial crisis. And so I think what you're doing, again, you've opened up my mind. What you're doing at the Longevity Institute is not just important for clinical health and for health and longevity and for our life and well-being. It actually is important from a world economic perspective. And I know we're kind of going off track here, but you just spoke at the Davos Institute, right? And which is amazing. Congratulations. That must have been an amazing opportunity. Why did they have longevity? You as an expert speaking of longevity, I know they had I think a whole longevity day or why was longevity part of an economic forum, the Davos Institute?
exactly because of the reason that we talked about. Since there is a huge impact on the financial world, and just adding 1 year of health life to a person worldwide will save $36 trillion. This is the data.
Wow.
So
Wow.
there is a huge economic effect.
Wow.
The fact that the population is aging and we increase all the time our lifespan, and the health span is not getting better, it's an economic burden. And I think, unfortunately, the economic sometimes speaks more than the physician.
Yes.
The so kind
Well,
of
I mean, I think again,
hats.
Tzipi, just jumping to another implication, which I think is an important question here, which is I was going to ask you, like, who's going to pay for this? Because it seems like it's precision medicine, it's personalized medicine, it's more time, more cost, maybe. I don't know. You could tell me if that's true, but it seems to me if I was a country right now, if I was a public health, leading a country, looking at those costs, I would be calling you up right away and saying, how do I get a longevity, bring longevity into my country, into my state, into my county, so into my employee, my corporation, if I owned a company, because we need, well, companies a little bit different because people leave companies, but countries and states and counties and nations, people stay, populations stay, even the Medicare population. Again, I would be knocking at your door and saying, how do I get this? Because this is, put aside the health issue. Just let's put aside the fact that it'll make my population healthier and happier and support the individuals and families. But from a basic sheer economic perspective, this seems like mission critical at this time. If there's a moonshot, and Tzipi, tell me if I'm going off kilter here, but if there was a moonshot mission of our time, I would say the moonshot mission is health longevity. That is what we forget about landing on the surface of the moon. We have to land the health longevity mission. It really is. We've got a few years, to your point. We don't have a lot of time. Maybe we have a decade to get this right. But that's the way I honestly had never understood the implications of what you're doing and this whole health longevity movement. And yeah.
First of all, I have to say that the WHO understood that, and they claim that, and they ask, there is a call for organization, for government, for private sector, for business. And it was from 2020 to 2030, there is a call from the WHO to invest in health and longevity. So
the WHO, the World Health Organization.
Yes, but it's from the health part, okay?
Yeah.
Understanding that. And I do think that it starts now. I mean, I have talks with the insurance company that starting to understand the meaning of it. And by doing what we are doing and having the study and to show that if you are doing a longevity intervention and you are trying to focus on that, you will improve the outcome, then hopefully insurance, government will pay for it, because at the end, there are tests that someone needs to pay. And if the government is smart, they will pay, because otherwise they will need to pay for your cancer, for your cardiovascular, for all the treatments that you are going to have in 20 years from now. But if you pay a little bit now, you will prevent it. It always takes time, but I think the only thing I like from the Instagram, the Brian Johnson style and all that it puts the longevity in the awareness.
Yes.
So this is what I can say. Something, if I want to be, okay, let's be optimistic, or let's see what is good in everything that is going on. So really put it on the radar. The radar of longevity is hype and it's up. So people are, okay, what's going on? And let's
at least
look
they're aware. Yeah, that's the positive side of it. Yeah.
Exactly. So there is some positive in that.
One question, and I want to try to make it quick, but it's not a quick question. A lot of the lifestyle medicine stuff that you're talking about, these interventions, they're fundamentally about behavior change, right? And it's, again, sustained behavior change, I think, is the key here. And so, because doing it and stopping it is not in the long run as helpful as obviously continuing it. So what is it that have you begun to explore that part of the intervention in terms of what is effective? What are you guys doing now? What is the Sheba Longevity Institute doing now, a center doing now in terms of helping people with behavior change and sustaining that behavior change? And are you thinking that you might actually even want to study that, or is there enough literature that you're looking at the science of habit formation? I'm just curious how you think about that and how much you've explored that part.
So first of all, creating change is one of the, if I have a pill for that, I will have a Nobel Prize and we will all be very healthy, because, it's all about changing and try. At the end, we all know what is need to be done. The difficult thing is to do it.
Do it, right.
Of course, this was in our mind all the time. Two things, I think. First of all, when people come to a place like this, they see their biological age, they see all the data, and they understand the effect of every little thing on the general health and on the age and performance. It gives them some kind of a different perspective, which they didn't have before. And it's kind of it's some kind of a motivation, okay? But then when they go out of here, how much it lasts? This is the old question. We all know diets, 3 months, then you stop. So we develop an app that we kind of monitor. So it's kind of engaging. So it gives every day you get a score, and there are contests in between the participant who improve the best, more steps during the day. So there is 2 weeks of contests, and there are prizes. Even you can want some. There are all kinds of that you can buy or do or this. You gain points. The higher the score is, the more points you get, and it's money. And then you can use it. You can even buy things from the store that we have. So or donate it. All kinds of this thing. We are trying to create kind of community that we encourage people. We do give phone calls. We try to call. So it's at the beginning it was once a week, and when we have more and more participants, we kind of, we don't have enough manpower. So we have it like once a month, a phone
Mm.
call, what's going on, try to, to motivate again. But
Are you using Tzipi? Are you using wearables, or do you have do you
yes.
recommend wearables? Or do you connect with like the wearables that are out there, the commercial
So we
wearables?
connect to the one that they have. So our app can connect to whatever you have. You have Oura, you have Garmin, you have Apple Watch. If the person doesn't have it all, so we give a Xiaomi watch. So we have at least some minimum sleep steps, things like this, heart rate. But don't forget, we are a public facility, and we don't ask for a lot of money, so we cannot. Like if I had a personal coach that some people we can, talk every day with the person, it would be, of course, better. But I
Mm.
have to tell you, it depends on the personality. I mean, even in the app, we have kind of a questionnaire. You have 5 typecast of person and what will motivate. One
Mhm.
person
Mhm.
uh, contest will motivate. One
Mhm.
person, if you will, be frightened from a
Yeah.
disease or something. The other person doesn't
Oh,
like.
interesting.
Yes. So we have kind of questionnaire to understand what type of a person you are, and
Okay.
then how your nudge will do
Oh, interesting.
um,
Yeah.
but it's a whole psychology, which I do have some PhD that is working on it, how to improve or to motivate people to do change.
Yeah.
And it's a big issue. It's a big issue, of course.
Tzipi, how can people learn more about what you're doing? And also, if there are organizations, academic medical centers across the world, um, that are interested, or hospital systems or others that are interested in connecting with you, what is your thinking about that currently, and how can people do that?
Our center has 3 arms. We have the clinic arm, which are, of course, we are open to. We have actually patient that comes from abroad. We do it connected afterwards with Zoom and etc. So no problem at all. So it's the clinic. We have the research arm. So
Mhm.
we are doing research together with the Bach Institute, with Singapore. We have X Prize, which is we are doing with
Mm.
Hong Kong. We have a lot of research here. Also, double-blind placebo control with pharma. So we just did talking about peptides. We did a microdosing, but it's a study. Again, it's a
Right,
study.
right.
Signed consent. We gave them peptides. We gave GLP-1, metformin, all kinds of peptides, and they were a control group, but they still didn't know what they got. So it's a study that we did together with pharma. So there is, of course, because we have a lot of people here, and they are willing to participate in all kinds of study that we offer them.
Mhm.
So for pharma, for everybody who wants to have a better site for research, of course, we can collaborate. We have a collaboration, and we are open for more collaboration. And the third arm is innovation. So we do have venture capitals, new technology that
Mm.
companies want to check, to validate. We did have Quantalax, it's a Delphi, it's a machine that we actually validate here for almost 1 year. We did it on our patient. It's an
Mm.
it's in TMS, EEG, transmagnetic stimulation for EEG. So we have EEG and stimulation, and
Uh,
the waves, and we can predict decrease in cognitive decline and
mm.
Parkinson. So it also
Wow.
got FDA approved during our trial, and now they are doing an exit. So
Mm.
it's something that we partner with them. We have so different device and technology that we are checking, either validate or even even at the beginning as a consulting and trying to build together some sleep enhancement machine or whatever. So of course we are open for that, for collaboration. We do have
Wow.
kind of our incubator for longevity here in Sheba. So there is someone that actually kind of like gathering all the people are writing for us. So, and to check
Like startups. Yeah.
something like this. So of course, all of the arms, like we are open for patients from abroad, of course, for companies to do collaboration with trials, research, or innovation, digital wearables, and any other assessment,
Wow.
diagnostic that they want to check or validate or get some proof. Because at the end, when a company or some kind of device has, our validation paper, academic, that say, okay, this is a great diagnostic, we use it, it's helpful, it's a different, it's a, put the device or the supplements or whatever in a different level.
Does. Yeah. Tzipi, Dr. Strauss, this is just, I have to say, mind blowing. I think this is the future of healthcare. And the fact that you're doing it in such a rigorous, scientific, thoughtful way is really impressive and encouraging. And I'm just excited to see you progress. I hope that it spreads. And I would love to follow up with you again and see where you are in a few months.
Thank you very much. I would love to. It's always a pleasure to talk with you, and I will be very happy to continue and have some more good news.
Thanks.